here, we think are going to provide a great kind of contra to the health system conversation. These are all practicing physicians, they're social media influencers, they see patients every day who give them healthcare data, AI data, some combination of it, and how they respond, what they've been seeing, and if they even like patients coming in with data versus AI versus pick any combination of. So I'm going to let them introduce themselves.
Thanks, Aakash. Hi, I'm George Matthew. I'm an internal medicine physician, still practicing. Just grounded this morning and then ran over here. Also doing a startup called Times Health. It's a privacy-based AI chatbot. We've been on the Apple Store, just raised $2 million, so took a long while, especially in this environment. Prior to that, I was the Chief Medical Officer at Hewlett-Packard.
Let's see if this might work. Hi, everyone. Dave Kessler. I'm a pediatric emergency medicine physician, work up at Columbia. I'm a hopeless academic, so I've flirted with the dark side a lot. I do a lot of my academic research with industry and other groups, but I've stayed within that academic system. So I'm here really more to share that perspective of how to partner.
Hi everyone, good afternoon. I am Peter. I am a pediatrician, and I think I was the social media influencer that they were talking about. During medical school, I started an online brand where I wanted to sort of do a little health tech, but now I figured out that it was sort of very much doing health tech by creating videos online on TikTok, on YouTube, to teach parents how to take care of their kids. So when a patient would come in and be like, oh, my child had a fever, it was 98.6, and I'd have to explain to them that a fever threshold is, here's a nugget for you, 100.4 and higher. I realize a lot of healthcare is sort of bogged down in lack of health education, health literacy. So taking the patient and reaching them where they're at on their phone by creating health videos, and so that sort of skyrocketed, and it has over like 200 million views, which I'm very blessed to have. And so I'm excited to share some thoughts today from the patient perspective and what people are saying online.
Awesome. So we're just going to get started with our first question. Also, just to tell you guys a little about me, I'm in biotech, so I'm the one non-clinician on this panel, kind of coming in with that patient perspective. And so for the first question, we see that there's this rise in what they call cyberchondria, which is hypochondria, but caused by what you see on the internet. People coming in, asking for referrals, asking to see specialists, asking for tests that they don't need. My sister came into the emergency room because she had shortness of breath at 2 a.m., and AI told her, you should go see somebody, and they did some tests, nothing happened. So I'm curious what you're all seeing in your different practices, if people are coming in with greater frequency and sort of coming at you with, this is what AI said, and I don't trust you.
As the front door, I guess I can start, in terms of the emergency room and dealing not just with my child patients, adolescents, but also their parents and grandparents and all the anxiety that comes with it. So I don't know that we're seeing more of it. If you just look at the volumes of visits to the ER, same steady growth, et cetera, follows other trends. But it's definitely new what's causing the anxiety. So I think it's becoming increasingly common to have to address that. What do you call it? Cyberchondria. I love that. Cyberchondria. The difficult thing is, more difficult thing is the loss of trust in the profession. So I think as there's more trust in the apps or in a social media campaign, then they might come to me and sort of maybe not place that trust as much in the professional in front of them. So that's a challenge.
I think we're also seeing something fascinating where if you think about how pharmaceutical companies are sort of pitching to patients at home. You're sitting at home, it starts off black and white, and they're like, are you miserable? Do you hate your life? And then like, here's rainbow pill, take rainbow pill, and like everything will be, there's always a dog, and like suddenly everything's with frisbees and stuff. And so you imagine that life, and they always end it with, ask your doctor. And sort of AI has become that, where you have this idea of either closing the loop of what you think your diagnosis is, or wanting that life, and so it gives you a pathway. And so you go in to see the doctor, and the doctor either says, I don't think so, or no, and so they're the one who's the limitation on your dream, on the frisbee life, on the dog life. And I think that's frustrating because it makes us look like we don't know what we're doing, because AI always gives you a definite answer, but at the bottom it says may make mistakes, and we're not really allowed to make mistakes in our field. So I think one question I had for the previous panel was sort of like, where does the responsibility lie? You know, like, it's fascinating that AI could just say anything, but then we can't just say anything because we have a responsibility to you, to your children, to your grandparents. So I think it's a little bit more nuanced than AI is making it out to be.
So I'm more on the inpatient side. I work as a hospitalist, so I have people coming in. Sometimes it's the patient who has the Cyberchondria. Sometimes it's their family member. More often I get the family member that's just looked things up before they came over, and they wanted to kind of either show me, sometimes prove me wrong, because ChatGPT said it or Claude said it. And I'm not going to lie, there are times it makes observations like, oh, you know what? I didn't think of that. But then for every one of those, there's probably 20 that says, well, this says I have Ehlers-Danlos syndrome, a connective tissue disorder, so that's why I have this problem with my aorta. And the time it takes to go through it, educate it, that takes away time that I can actually use to take care of the patient. It's not to say I think the tools shouldn't be used. I think it is an educational tool because people are very interested in their health and their family's health. But it is that lack of trust that you guys mentioned, right? Where I don't have a vested interest in trying to dissuade you one way or the other, and I am responsible. I am liable if a mistake gets made. ChatGPT is not. Claude is not. And there is no real consequence for if they make a mistake. But how to flip that? For me, it's been, because I'm lucky compared to most, I have time to build a relationship somewhat with the patient. I'd give it an 80-20% that a chance that I can actually convince them I'm not trying to steer them the wrong way, trying to give them the best information possible. And I do try to listen when I think it makes sense. I don't think it happens that often where they say, oh, you're lying, you're trying to cheat me or hurt me. But it does happen.
You know, I love that. And I feel like, you know, one thing that I see a lot, at least from an emergency department standpoint, is people coming in with, like, a deluge of data points that are like, hey, my Garmin has like 87 tests. One, why do I need any more of your tests? Because I have my tests that tell me I definitely have this rare, you know, congenital heart condition that just wasn't diagnosed for 86 years. And then two, you know, why am I repeating these tests? Like, why do I, you know, my thing tells me I have AFib, I don't need your EKG. I'm not paying for it because my $200 Apple Watch told me I have it. And that's a hard conversation because I'm asking someone to pay for something that, one, they don't know the cost of, and then two, to repeat something that they already are convinced that they have. If it comes back positive, they have it. Why I just pay for something for no reason? And if they don't have it, it's like, well, yours is probably not as good because it's not continuous. I don't know how you guys deal with it. And there's, you know, pick your healthcare startup. They pitch hundreds of monitoring things. Like, you can heart rate variability to sleep scores to stress, whatever that means. I don't know how you guys deal with it or talk about it or.
Okay. That's interesting because I don't know if it's just my experience is somewhat the opposite. Usually people want more tests, I think, in general, you know, but I'm often more having that conversation of risk benefit and why I might not do a test. And so that's challenging because it's certainly a lot easier just to order the test. Yeah. And sometimes that's what I have to say. This is like so much socially and otherwise easier for me legally, you know, like if something happens tomorrow and you happen to have the thing, it's so much harder for me to spend now 30 minutes talking to you about why you don't need a test than just ordering it, right? Which is just your time, your expense, etc. So, I mean, sometimes that does build some trust, but then also it's like, it does take a lot of my time. So I find, like you were saying, like I'm going, you know, from room to room trying to sort of answer and explain risk benefit, and we're terrible. Even doctors are bad at Bayesian logic, you know, but sort of what's that pretest probability, you know, and the you know, whatever it is, 23andMe that tells you have a 0.1% chance of some cancer, and then they come in and want like just screening labs just in case, you know, again, it's more likely to lead to the MRI that leads to the biopsy that was unnecessary that then paralyzes you, or, you know, you die in anesthesia, like, because the 1 in 1,000 risk there is a lot higher, right? But it's really hard to explain this stuff, and especially when you deal with the cyberchondria or all the hypochondria, and a kid hit their head and then they're just looking up concussion on 1,000 apps and they just want the CT to explain why, in 50 years when they get thyroid cancer, and I'll be retired, hopefully, like it doesn't affect me, but why I think it's not the best for their child.
And suddenly the human has become the second opinion, and they already have a concept of what they want when they're coming in through the door. And so you're not just educating anymore, you have to sort of de-educate to re-educate, and it's a losing battle because you're not the first one there. You didn't make the first impression, you didn't give the first diagnosis. And when a parent comes in and their child has RSV, we know there's like a predictive pattern that like day 4, day 5, it's going to be really bad, but then they'll get better. And so in the room, you have to be like, trust me, we've seen this 1,000 times. Like, I know that it looks really bad. It will get better. But if AI is telling them, no, you need more. You need to get them intubated, all this stuff, you're like, whoa, like I'm not going to do that because I know it's best for your child, but I have to maintain rapport with you. So it becomes really challenging.
I think the tough thing is also trying to compress what you know in a short period of time. The Apple Watch example is great. I remember when it first came out, everyone was thrilled about the fact it could track rhythms. But then, outside of getting special permission from the FDA, they for a long time were not considered a clinical wearable, yet people were treating it like such. So how to distinguish things that I know, like reading an EKG, and then interpreting that and using that for clinical judgment versus basically a digital biomarker that may or may not be proven, that is basically pushing people in. I remember when Apple Watch first came out, the big concern is we're basically safety testing the Apple Watch for free in the health system because a lot of false positives coming in with people concerned, the Cyberchondria, as you say, that they may have some type of arrhythmia, and they're going to their doctor, which fine, I'm putting more patients into the system, but now we're clogging it to the point where people that may need actually help may not get in because other people are more concerned about what their Apple Watch said instead of actual symptoms. And it's hard to compress that into a 5-minute conversation.
You make a really good point, George, about wearables and people coming in with their own data and the false positives. So a question for everybody here, similar to what was asked last panel about biomarkers and if they have value. What sort of health tech data do you think is actually valuable versus what is noise?
So, we don't suffer from lack of data in medicine, right? We suffer from lack of attention and focus. And so I think the apps and the wearables that can sort of help reduce cognitive load for patients and for providers are going to be the most effective at integrating. But I think a lot of them are this example of like the Apple Watch, or was it the Owl for kids with like sleep apnea, right? Yeah. Who eventually got a letter from the FDA. And so like, again, I understand from a business perspective, it's like, get the market out there. It was the hottest thing. Everyone had to get that with whatever stroller was hot at the time, and then patients come in because the thing alerted 20 times and they say, but my kid had apnea. So what do you do with them? You clog up a bed, you admit them because you're afraid of being sued. Like, you have no choice, right? And this was not a legitimate, measurement. So I think the ones that, obviously I'm biased from my perspective, but the companies I've worked with in designing some of their tech from the start, being involved at the inception, I think they go on to be more successfully and robust within the healthcare ecosystem because, they sort of, you kick the tires before they're tires, and then when you come out there, you'll be integrated. I think the ones that are like, these doctors are too slow and conservative in the healthcare system, let's just design it outside, get an audience, a consumer base, and then try to force it upon the healthcare system. Unless you're Google or Apple, this is probably what they're doing, but I think for the other ones, you're best off working within us.
I'm sorry, how do you respond to parents? Just because...
With when they come in with that, so it's a mix. That one's gone. But I have friends who say, "Should I get this thing?" Because we're all so concerned. I think the parental anxiety, I think, is a huge market, right? Sometimes I'm like, if I just want to retire, I'll just make something that preys upon their anxiety. Right? This is what happens, right? And it's like I would never do that, right? As a pediatrician, but this is what you see. It's like now there's a new tool for cleaning your ear, for relieving your gas, for doing this. What if they choke? You need this suction thing, and it's just preying upon anxieties. And what we do in healthcare is often alleviate or calibrate anxieties, right? We're sort of like, I have to again explain the denominator and explain risk. So what do I tell parents? About devices when they come in. Usually they're coming in because they're scared and finally there's a moment of trust, and so they came for a professional advice. I just give them whatever the advice is in that moment. I try to be honest. I say, I'm not here to sell you something. I'm here to tell you the truth.
Yeah, those are excellent. I love that. I'm going to pocket that. I'm going to tell you all two quick stories. The first one is I was at a conference and I was invited to go to a booth for a pediatric tool that was designed, an AI tool. And they were like, "You're a pediatrician, you have a social media brand, we want to talk to you." I was like, "Great." I went up to them, and it's an AI chatbot for children who have mental health conditions, depression, anxiety, and so the child's supposed to chat with them, all this stuff. They gave me their whole pitch. Wonderful. But I think because one thing that you mentioned is very important, I asked my very first question as a pediatrician, which I hope you all would also ask, is what happens when the child says a red flag statement? And then this person who represented this company said, "What's a red flag statement?" And I said, "Okay." I made that exact face. I was like, so like, I want to hurt myself. I want to commit suicide. And they said, "Oh, well, we notify the pediatrician through the app." And I said, "Hold up. If it's 3 in the morning and the pediatrician's asleep, legally, I would then be liable. Like, do you guys not activate emergency services?" And they were like, "Oh no, we've never thought about that." And I was like, "Okay, so do you have a physician on your advisory board?" And they said no. And I said, "Okay, so this is like the problem. We're just preying on people's parental anxiety." So that's story number one. Story number two, because again, the social media thing, I got reached out to by a company that said, "We made a specific vest that children can wear at night for sleep apnea that will sparkle when the child breathes, so that when the camera's on the child and it's black and white and has night vision, as they breathe, the glitter will sparkle." And I was like, okay. And then I checked their site, $90. $90 for like a piece of glitter on a little baby onesie. And I was like, you could just do so much to prey on people's anxiety, and as physicians, we are held to that higher standard. Someone had asked about AMA earlier. I do think we have to calibrate people's expectations that this is not just a consumer market where you could just get whatever you want. There has to be someone there who's hopefully, this is the ethical question, doing what's in your best interest. We are co-adventurers on your journey of health, and we trust each other.
You were asking before about how do I distinguish between the data people bring in versus data that I'm comfortable with. And I try to answer it the same way I did before, which is my training is I can interpret certain things. You give me an EKG, you give me a pulse oximeter, you give me a any type of meter that I've gone through, that I can make clinical judgment from. Could I get directional information from, well, Fitbits aren't such a big thing anymore, but Aura or an Apple Watch? Sure. But deriving actual clinical judgment from that, that's where I feel a lot of companies kind of put it back on the doctor to make a clinical decision on it, including the liability, because they won't take it on. They don't want that. They want you to buy the consumer aspect of it, but then any type of downside, that should be shared between the clinician and the patient. And I try to explain that. I think for the most part I've been pretty successful at it, because I tell them, look, your Apple Watch has this really weird reading here. What happened? Oh, my son borrowed it for a little while. I'm like, oh, that would explain it, right? There are these little things that happen in life that I can't account for, and quite honestly, I've not been trained like in going through 10 weeks of Apple data or having something to synthesize it so that I can just read it in like 60 seconds. I got a 15-minute visit to take care of this. So I try to explain it as best as possible, but I do try to keep an open mind because, to your guys' point, people are convinced that this is telling them something. I don't want them to lose that interest in their health. I just have to tell them there's only certain things I can do with it.
Yeah, I just wanted to add one thing on the pro side, especially because you mentioned fever earlier, 100.4, which is when you go back to that literature, it's so archaic and so, right? So it's like, it's made up, right? It's somewhat made up. We have to pick a number. And so I'm excited about the future where we'll have like precision, personalized vital signs, and that will actually help drive clinical decisions. But there's so many pieces to connect in between. And if all you're doing is giving me a thing that says, my kid, according to my kid's device, they have a fever at 98, or their fever is not to 101, and then I don't know what to do with it because there was no support of the research that comes after of outcomes. It becomes just confusing and, I don't know, at best causing more anxiety to everyone. I think there's something there, but I think we need to work together to sort of make that meaningful and connected to a clinical decision point.
So on the hopeful side, what I want from AI as a physician is I want it to help with the pattern recognition. There is, like we're not information or data poor. We have so much information. I think that AI will help us make connections. Again, at one of the previous, Google had a cancer AI symposium, and someone said that they fed AI all the physiologic pathways and pathophysiologic pathways of what a disease is, and all the pharmaceutical pathways of what this medicine does, and had it predict which medicines could possibly treat some of the diseases we don't have remedies for. That's fascinating. And then they're trying to build like AI patients that can get tested so that we don't have to do it on actual humans. That's fascinating. You know, like I'm also a theater actor, so like when you're on stage, that's a specific kind of humanity that you need, but we can replace backstage. Like the tech, the lighting, the sound, like that is something that we can use AI for, but I don't think you'll ever be able to replace the human part. Like someone said earlier, the human will be overseeing the robot, maybe doing surgeries and intervening and saying, no, don't, that's the heart actually in this patient, they have dextrocardia, it's flipped, don't do it. But like the AI would be like, well, I'm 95% certain, and just go for it. So I do think you need that human oversight because we are more nuanced and we are able to break patterns when we need to.
No, I love that. I love that human piece because the drugs that are coming out, I expect to live to like 5,000 just because my BMI will be like 1. And I kind of wanted to shift the conversation towards like the optimization culture. If anyone's on X, it's just, man, this drug is just the best thing since Wonder Bread. All your fat markers are low, your performance is through the roof. And it's kind of a weird time because we had COVID 5 years ago, so the world shut down, healthcare was super taxed, and then you had a bunch of quote-unquote untested vaccinations where everyone's like, this stuff is awful, and then a year later everyone's like, no, I'm going to take every drug that a compounding pharmacy makes, I don't care if it's tested or not, it's amazing. It's kind of a weird shift in like 5 years if you think about it. I just love your thoughts on it. Like, what do you guys see when it comes to like patients coming in saying, I want to try this drug, be on this drug. I've heard, through the grapevine, and my neighbor's dog's best friend had great results on it. And how do you like dissuade them from it? Because they're going to get it from somewhere. They're going to find some agency who will give them a 10% valuable, 10% authentic drug, but they're like, yeah, it has some efficacy.
What is the purpose of a doctor? What is the purpose of a nurse? What is the purpose of someone who is there? Because are we up here just dispensers for your care? Like the pillars of ethics are justice, you do what's right, then there's like beneficence, you do what's good, non-maleficence, you don't do what's bad, and then patient autonomy, they get to make their own decisions. But it seems like, at least in the Western idea of healthcare, autonomy is the most important thing. So if you come in and you say, I want you to cut off my arm, do we just do that? Like, we have to ask ourselves as a society, are we just people who give you what you're asking for? Or do we get to say, actually, let's talk about why you want that? What's going on at home? Especially as pediatricians, like, we have to manage what the parent wants, and then what the child wants, and then what the child says to us secretly when the parent isn't there. Not secretly, but privately when the parent's not there. So we are juggling a lot, and I think my position, just to make it, is I don't think we're just doing what you're asking. I do think that's why we go to school and we lose our 20s and we spend $500,000 in debt just so that we can help you, because we actually do care. But once you pull that out and you just expect us to do it, because if I say no to you, the next doctor who could not care less will say yes to you. But what's the best thing for you?
You just made the best argument for preserving academia, which is also under attack in this country, in this world. But it's because we put our caring first, because we sacrifice so much, and we de-bias ourselves from all these other incentives, right? So that our only incentive is just making the right decision for the patient. But consumerism is really threatening that. I think, probably our most, we don't deal as much with the compounding and yet, and the GLP-1s and stuff like that, but we've dealt with it for decades, in pre-AI and stuff with regards to vaccination. And so you alluded to it somewhat, right? I mean, yes, I'm still getting the COVID and flu vaccine every year. Yes, tons of my friends just called and said, oh my God, my kid has the flu, what do I do? And they want to take Zofluza because that's popular online and super expensive and just once. But, I don't get why that's more natural than a vaccine's one of the most natural things in the world. We've failed, and hopefully you're going to fix all this because you have a trillion followers and I have just my 3 friends. But 4 or 5, right 4 and 5 right here. Yeah. But I don't come from that generation as much to put it out there. But that's what we need. So we need more of you in healthcare because we're losing the war. We're losing in terms of that public health facing. And a lot of people will come and they'll say, and by the way, follow this guy because there are also a lot of people who are out there saying they're a doctor or they are on social media that aren't. So that must be
can't find their degree anywhere. You're like,
right.
Kind of a doctor.
And people at every part, oh, do you guys follow this ER social media person? I'm like, and I look it up and I'm like, that's not even a physician. And it's like, this is where people are getting their advice. So we need more of you to help with this information work.
So I agree wholeheartedly with everything they said. And I've been thinking about this for a little while just because, to your point, the pandemic really did us a disservice. While we were trying to struggle to save people as much as possible. Like I was in Westchester, so we had some of the first cases before it migrated out to the city. We were proning people in the whole 9 yards. I guess that was not an approved comment I made. Scratch that.
Didn't like proning.
Didn't like proning.
But it did dent the trust people have in us because they were concerned that we didn't have an answer, and we didn't. This was all brand new. We'd never dealt with anything like this before. I've talked to colleagues of mine, they're in their 30s, that were doing residency at the time. Being in my 50s, it's one of those things where you're kind of looking at them and you're like, dude, you went through basically the Vietnam War. Like, you went through wartime medicine in a way that I've never been through it. So they've got more experience in some ways than I do, and I've been doing this for 20 plus years. Closer to the mouth. All right. Sorry, I was worried about the AI again. That's my coach in the back. So I think what happened is what was filled in the gap was this idea of I need to take care of myself. And I think a lot of that led to some of this new longevity movement, led a lot by very wealthy folks. What's his name? Brian Anderson? Johnson. Yeah. And the enhanced games. Yeah. There's a lot of people that are out there telling you what worked for them. Whether they're doing it or not is another matter. But when you look at it, part of it is also what are they really trying to do? Because of this new consumerism, the new value prop isn't you go to the hospital, get taken care of. It's I have a certain health need. I'm going to you're making a promise to me that this will have some type of benefit in the near term or the long term. Again. And then I will exchange money, and then something will happen, and I don't know what that will be. And I'm okay with that exchange. I think that happens with some of these GLP-1s, which people aren't talking about the side effects enough. We're starting to see new indications. We're also starting to see things like anhedonia, increased suicidality, that type of thing. Some reason doesn't seem to make the press as much as it should, despite the mechanism. And then when you talk about AI and using large language models, again, there's a lot of hype about these models where people go in and say, I uploaded all my information and it came up with a diagnosis my doctor never gave. That's great. Who owns your information now? As a consumer app, they're not bound by HIPAA. You've just fed into their data model. Their foundational model now can use it for discovery of things like drugs, and they own the IP. That's not a conversation they're having with you up front. And I don't like that you're not being transparent to the user or the patient. But I do think that that's kind of where we're going, where ultimately, because I think they brought it up with the AMA as well, the AMA has been fighting Congress on who is responsible for AI outputs. And in the end, it will be the clinician, because the AI companies will not take liability for any errors made. If insurance companies start pushing the way they are, I think what will happen is they'll offer a lower cost product driven by AI, but now the liability will rest with the user, not a clinician, not the insurance company. Buyer beware. I don't know if this conversation is being had enough, but I think going back to what you're saying before, why has it gone this way? There's been this idea that you need to take care of yourself, and it's put us almost at odds with each other. And I think a lot of clinicians, especially you guys that have grown up with the tech, you'll be hard pressed, but I think you'll be successful in convincing people that we really are just trying to help. Sorry, way too long. I'll
Yeah, no.
shut up now.
That is a very important point you're making, and definitely something the next time to think about when you're uploading your health data into AI. On that topic of longevity trends and GLP-1s, was listening to the Huberman podcast this morning. They were talking about how people are doing the trinity of a GLP-1 plus growth hormone plus an androgen. So how do you think about all of these doctors and people online promoting things like BPC, 157, all these peptides? And maybe a question for you, Peter, as well. Like, what should the role of a physician who's online and has a presence online be?
So, it's a scary place to be, truly, because, like we said before, anyone can say anything they want online, and the human mind really drifts towards drama more than love. Hate gets more clicks than love does. So, and these people online get paid when you like, when you share, when you comment, and so you're just, not you, but like we all are feeding the algorithm to keep pushing these kinds of conversations. So I was approached by a company to talk about maybe I shouldn't
talk about it.
to talk about anti-aging collagen peptides that you're supposed to eat. And I said, you know what? I'm not going to be a naysayer. I'm someone who wants to believe that we can find new things in society. So I said, please send me your data. So they sent me their research studies, and I reviewed them. Here's what's really interesting, and I wish that maybe I'll make a video about it, to teach people how to understand research. Because this company sent me all their research, and it was like a bunch of doctors, a bunch of different research studies. They had all these things, and then you look at the disclosures, and it says that they have nothing to disclose. And I was like, oh, so there was no conflict of interest. That's amazing that they proved this and all this stuff. So then I did my own research, and I looked up each of these doctors, and they all worked for the company. They all work for a different company. No, they work for the same. Hello. They work for the company that sent me that same. They work for the company. And I thought it was so shady that they were sending this to me, acting like it was validated research, asking me to talk about it, and they wanted me to use the language anti-aging. And that's just wild. Like, if you eat so much of it, you're going to become a newborn? Like, what? Like, that's so weird. But again, marketing is so important for the human consumer. So when doctors online say things, I think the very first step is to really look at who are they? Are they real doctors? And what kind of doctors? What's their specialty? You know, if I said something about urology and I'm not a urologist, like, that's also a little concerning because I'm a pediatrician. I should know, your lane, stay in your lane a little bit. And I think that we've gotten to a place where we've monetized anxiety, and because you can just say anything you want online, as long as you get clicks and you drive traffic, you'll make money. These influencers, these people continue creating, and it's usually the person who only has like 300 views who actually is talking about something, who's actually a doctor, is the person who's saying what's true. So I think we all have to be mindful, and maybe even with my parents, like, I have to say, like, that's AI, don't watch that video, and you have to like sort of be people's guardrails, when they're bowling, like, hey, no, not that, maybe not that. And even in the office we have to do the same thing, but online has gone crazy because these companies, social media companies, don't care. Like, they don't regulate anyone saying anything false because it's either on the influencer, it's on the user who's consuming it, and then there's just mass chaos in between.
We are running close on time, so we wanted to kick it to the audience for any questions you may have. It could be anything: wearable, AI, peptide of your choice. Yeah.
So I work in outpatient psychiatry, eating disorders specifically. So we work very closely with pediatricians, primary care doctors. I wonder what you guys have seen on the impact of AI and using these tools on help-seeking behaviors when it comes to either parents or patients themselves, especially in mental health. There's always like we want them to be care-seeking, but we also want to balance that. So I'm just curious about the care-seeking aspect when it comes to patients and what you guys have seen about that.
So the question for the back was, in adolescent mental health and behavioral health, are we seeing a change in care-seeking behavior that relates back to their use of AI?
Yeah.
I guess personally, so we have a behavioral health crisis, no doubt, as you know. And we see a lot of that, as we see a lot of society's issues in the ER first. Like 25% of our ER capacity is often just people waiting for placement due to needing psychiatric care and not having enough inpatient capacity for that right now. We know from the literature a big driver is social media in many ways. I don't know that I could speak to people coming in specifically saying like an app directed me here, if that's sort of the part of the question. But I think interacting, in general, digitally has been a big driver, I think, of this epidemic that we're seeing.
Yeah, I think I like it when the teens come in because that's the trust aspect. I get to say, thank you so much for coming in, what's on your mind? And like in pediatrics, we have the HEADS assessment, which like goes through home education activities, depression, suicidality, sexuality. So we screen for everything, and that's amazing because we really get to know that person. And then the really cool thing, maybe it answers someone's question before about like, what do you say to the families, is you invite them back for a follow-up. And so it does burden the healthcare system, and for some like CMOs out there who are like, oh no, it's not good for us. But it's a good thing because I think it's an outdated concept that you're only supposed to see your doctor once a year. Like, what the heck? Like, in newborn, that first year of life, we see that child 7 times. Because things do happen. It's not that kids don't get sick, it's that you have a doctor who's there for like every 2 months. So I think it's a good thing to bring them in and to have conversations and maybe even get ahead of it and say, let's have you set up with a therapist, have you set up with a dietitian so we can talk about this before it gets worse.
Most of my patients are older, so I haven't seen as much in terms of dependence on using some of the LLMs. We see the typical hypochondriac type behavior. We have a lot of people with depression, anxiety, typically use psychopharmacology for most of it. We have had the occasional person that's come in, and done the, I have this because I looked it up type thing. You get that spider sense as to who's who, and then you know when you can fight it, when you have to just leave it alone. But that's as far as I've seen it.
Yes, this is more of a question for David, perhaps, just because being the Vice Chair of Innovation, there may be a number of people here that are innovators that have their own startup that they'd like to pitch to pilot potentially the health system. Just wanted to get an idea of what are some tips for folks that are kind of new to trying to get their foot in the door at health systems? Like, what would be a good way? I know Columbia's got lots of different innovation.
Yeah, I think places like Columbia, like they have their official offices that engage industry at different levels. There's certainly a much increased appetite in partnering than ever before, I think, because of the financial strains right now in healthcare, and especially with public funding availability. So I think there's an openness and a lot of initiatives now to partner more, hosting events such as this they've been doing. But I would encourage people, like where I tend to slot in, right, is smaller companies, startups, people really who come in it from like a good place, like we're trying to make a difference, not just we're trying to make a buck. And obviously you got to think of both if you want to make a difference, right? And I would say that on the academic side, I mean, I've done so much free consulting, I shouldn't be advertising that, but in other words, working with someone early who's in it for the right reasons, right? Like, and then, hopefully they're successful, they come back later, they're like, now we have money for a trial, let's do this. That hasn't worked out so much, but still, I like to see people succeed. So I would say, first of all, a couple of plugs. In the ecosystem of healthcare, I think ER doctors in general are on the more innovative spectrum. There are innovators all over, and I love to partner with them, but we have to be innovative, right? COVID, new disease. Blackout in NYC, had to keep working. EHR goes down, et cetera. You get it, right? We keep going, we figure out a way, even when we don't have the right tools. And that's to say that sometimes you think you have a killer app, and you're like, this reads EKGs, let me go to the cardiologist. Sometimes, that's not the most innovative person. Sometimes the big name at the institution, and where Columbia will direct you, say, oh, go to the chair of the department, is not necessarily the most innovative, because you got to be pretty conservative to end up as a chair, right? They might direct you to the right person, they might not. So I would encourage you, look for those people that are more hungry at the starting level, just coming out, like support, they're willing to partner with you, do this free consulting, and there's something in it for them long term. I think that's a good way to sort of forge a partnership early on.
So you talked about sort of parental anxiety, and as a parent of a teenager, especially like higher income parents of teenagers, like it's an anxiety fest. Like every parental meeting, you're either talking about work or you're talking about things you should be anxious about, and it's somewhat competitive. So here's the question. I'm wondering when too much information is a bad negative thing, which is to say, do we end up giving lots of more information to parents who then both react and then competitively react? And I know that sounds crazy, but parents are high-income parents, like incredibly competitive, like who's a better parent? And so at which point do we then chew up lots of health resources because you've got a bunch of high-income people like overtaxing the system where working class folks, middle class folks don't use it enough? Like how do we create equality when the information will get reacted to differently? Sorry, I know that was a lot.
No, I mean, real quick, I did ER because it's the great equalizer, right? Rich, poor, celebrity, like I have them all in my ER, right?
Yeah.
And like the beautiful thing is I don't have to spend just 15 minutes per patient as dictated by a system that exists now. I could say, you know what, they're overnight sometimes. I love to sit with an adolescent patient who's just never had, like for their behavioral health issue, being ignored in the corner because there's nothing to do but wait for psychiatry, and just talk to them for an hour about box breathing, anxiety, like if I have the time on an overnight. You know, that's one of my favorite things, that the time I spend with patients, I get to go according to their need. So yeah, I can't speak to the rest of the system, but and you're absolutely right. But I think managing parental anxiety, again, rich, poor, you know, lots of anxiety there all along. This is part of the job.
I literally ask. I say, are you the kind of parent who freaks out with more info, or you don't? And I literally ask that because I know that people can't handle, and they're just honest with me, and they say, I will freak out if you tell me more. I'm like, great, I will just manage you, come back for a follow-up, and we'll go from there. So, like, you don't ever, I mean, that I won't even say out because some people might freak out in the room. So there's always like the worst possibility, and that's why, to bring it back to AI, it will always put that on the differential. But as a physician, you know that's like almost never going to be an answer. But to someone who's anxious, that's the one thing they're going to bank on, and maybe create like some internal turmoil that, I don't know, causes an autoimmune disease or something. Like, it's just wild to give people so much information. Yes.
Yeah, we do a lot of that.
So, among you medical professionals, do you feel a heightened sense of anxiety and fear of malpractice and lawsuits, given that AI is not necessarily fully responsible, but also your hospital should be very much legally protecting you? Because I think about it, since my father's a retired board-certified surgeon, and how many malpractice suits and how many lawsuits and how many times he had to meet with his lawyers before AI came about. But still, there's no true liability or guardrails like you've mentioned prior in this discussion. So I'm just curious, how are you feeling as professionals who are being tested and tried against Claude and ChatGPT when you still have to worry about medical boards and presenting yourself sometimes?
So I built my own large language model, so that's how I handled it. I didn't like the fact that a lot of these companies were coming in with standardized guidelines and making recommendations that I had no control over, yet I was still left holding the bag if they made a mistake. So my co-founder is much smarter than I am. Basically, we built our own foundational model, made it so it was 100% private, so all the compute happens on the phone, and it's modeled so that when we are now building it for practitioners, it models against their advice, not just what guidelines are. And that includes thresholds as to when to refer to that practitioner. I've been doing this since 2001. My threshold's pretty low to send you to see me so I can get a hand to see what's wrong, because that's just how I was trained. I'm assuming you're a little more comfortable with telehealth than I am.
Yeah. but telehealth within reason, telehealth as like the first barrier, because there's so much social determinants of health, of like getting access to transportation or even being able to get into the room, that telehealth I think is another great equalizer. But if a kid looks horrible on the camera, you say absolutely come in. But you know, for example, a baby's just born, you have to see the pediatrician in 2 to 4 days for follow-up. If that baby's born at winter time, you're going into a pediatrician's clinic with sneezing toddlers and like everyone is feverish. You're endangering that child. So maybe telehealth could help us by saying, hey, let's do a 15-minute visit. You're at home. How's breastfeeding or bottle feeding? Like, how's the wet diapers? How's the pooping going? And not having to endanger that child just because we've always done it that way. But then, yes, if I'm concerned, come in. I need to put a hand on this child.
That's why I was saying it's different, even between 3 different doctors, even different fields. Even if we were in the same field, we do it a little differently. And that's why that customization needs to be there, because I want AI to be an extension of me so that I can treat my patient the way they need, that I would like them to be treated, not just because someone overhead's telling me to do it a certain way. That's it.
Yeah, I don't worry more about liability. That hasn't really changed for me. Whether it's grandma or grandpa who said you have to go do this, and they're a doctor, or whether it's something they read in the paper and now it's AI told them, like that hasn't changed for me. I think I worry more about getting canceled, and I'm not even on social media, because I think people are coming in also, and we didn't really talk about this, but recording conversations, real time asking, AI to sort of interpret, posting for all I know. I have people, that want to film me doing procedures and lacerations, or they'll just do it and you don't even know they're doing it. And so I worry about something taken the wrong way being posted online to 200 million followers, and then like my career's over. So everything I do, and I build trust, and because I'm going to tell you the truth, and my reputation means everything, and that could be ruined more easily, I think, online than via lawsuit.
Okay. Given that we have more of a social media plugged in community now, I've seen a lot more hostility and anger towards healthcare workers. How do you kind of cope with that? And there's a lot of frustration with the healthcare system itself that's being taken out on healthcare workers. Any tips on how to cope with that? And yeah, some of it is also like, I'm going to sue you if you don't give me this MRI like this very minute. Yeah. And they go on like Instagram and like post about it. Just curious on how you guys deal with that.
So I think this is one of those moments where we really do take a step back and reflect on what we all are here for. We're all human first, and they've done studies about how to really connect with your patients. Unfortunately, all of medical school is like from day one, like pill pushing, and you don't really get a class on how to communicate with people. It's basically improv. You learn a script and you go with what the patient wants. So one of the things that I love to do based on studies is you sit with a patient, because they psychologically feel like you're with them twice as long. And when a patient is emotionally connected with you and you are genuinely there, not just trying to push a pill or trying to push them out, I think that you're able to establish a level of trust with them that despite how the interaction goes, they will always come back to themselves and be like, well, actually, I do think they care. I actually do think that this doctor was there for me, and maybe will come back more. They're always going to have the outliers who are just like angry before even coming in, maybe because a previous physician did something. And I think that's where you call like patient services, and you just like get more people in the room to show how much we do care. But like personally speaking, I take it as a moment of like, hey, I'm looking at you, we're talking, I'm going to take you seriously, and I'm going to go do my research, come back, we're going to work on this together, and bring you back for another visit, because it does ultimately come back to the human connection. Technology is a tool, it should never replace that human connection.
Well, that's a wrap on the panel. Thank you to everybody for an insightful conversation.